I completely call this as a myth that once you get an IBS, your life is never sorted. But I feel with our experience, at least we have spoken to 2000 or 3000 IBS clients. So they are all warriors. They have a lot of things, and a lot of people came out very easily from this irritable bowel syndrome. 80% has come out easily, 20% are still there who are on the midline. It's not like nothing has resolved, but still they have to deal with certain things. So as long as you understand your gut, as long as you understand your tolerances, you take care of your mental health and lifestyle, you're not going to see your IBS back.
Hi, welcome to KC Talks. In the series of podcasts on nutrition that we are having with functional nutritionist Vineesha Reddy, let us today discuss what is IBS and what are its causes. Hi Vineesha.
Hi Casey.
So IBS. So I think in India in the current trend there's a lot of suffering that is more with IBS, and
Yes.
it is completely undiagnosed, right?
Yes, that is true. Yeah.
So what is this IBS and why is it at its growth?
Okay. Since audience should be new to this topic, they should know why am I talking about IBS. So I am specialized in Irritable Bowel Syndrome, and I did my Monash University certificate for IBS management.
Okay.
I also did my IBD certifications and SIBO, Small Intestinal Bacterial Overgrowth certification.
Okay.
This may be new term, new to understand, but I'll try to make it as simple as it can be. So when we are talking about irritable bowel syndrome, Casey, most of the time it goes undiagnosed, or by the time it get diagnosed, it would be too late for the person to respond to the treatment, certain treatment protocols also.
Okay.
So you might have heard about the symptoms like acid reflux, or occasionally having bloating issues, or occasional constipation, or there is changes in the bowel movement, like it could be mushy stools or diarrhea type of stools. You experience abdominal pain for no reason. So these occasional symptoms can gradually turn into a persistent symptoms. So if these symptoms of bloat, abdominal pain, flatulence or gassiness, and changes in your bowel movement, it could be incomplete evacuation, constipation, or mushy stools, or diarrhea, or urgency to use the washroom. So every time you are eating, you have that urgency to pass the motion. If these symptoms are persistent for more than 6 months, then you are diagnosed as irritable bowel syndrome. So this is a diagnostic criteria. Usually there is no diagnostic test for irritable bowel syndrome because it's a functional disorder, which means that there is something wrong with your digestion process, or you have low stomach acid. That is the reason why whatever you eat, it's not getting properly digested and it is making you feel so gassy. That could be one of the reasons. Second reason could be small intestinal bacterial overgrowth. So this happens to people who are regularly eating outside food, and they might end up with about a food infection. So when you have a food infection, you can end up with diarrhea, or you can vomit a lot. And after the course of antibiotics, actually the problem can start for 60 to 70% of the people who has an episode of food infection. So this after episode of food infection is called a small intestinal bacterial overgrowth, where you eat anything, you feel bloated. It can impact your bowel movement also. It can make you irritable with the bowel movements, diarrhea, mushy stools can happen. So low stomach acid, small intestinal bacterial infections, which is also known as post-infective irritable bowel syndrome, or it's a gut-brain dysbiosis, which means that when you have too much of stress and it is impacting your gut, that can also be the reason for your irritable bowel syndrome. Or microbial imbalances. You eat like a lot of junk and you're not sleeping in time, you're not taking care of your nutrition, and you're highly stressed. This may initially looks like a small acid reflux episodes, or you might experience occasional symptoms which are related to IBS, but these symptoms can manifest into irritable bowel syndrome in long term. Or you have chronic thyroid imbalances, and because of it you are constipated, or because of nutrient deficiencies you have mild symptoms of gut issues like feeling acid reflux, feeling bloated. And if these things are left unaddressed, in some cases it can turn into irritable bowel syndrome.
But I wonder, Vinisha, as you said, it is a functional disorder.
Yeah.
There has to be some diagnostic parameters or tools or tests or
Yeah.
something which should be used to identify it, right?
See, usually see what happens at the doctor office is, first thing first, you have to see a doctor in order to make sure that there are many other organic diseases which can make you feel bloated, which can make you feel constipated, can give abdominal pain. Say suppose in women, if you are experiencing these symptoms, you have to go see your gynecologist and make sure that you don't have any cyst in the ovaries, you don't have endometriosis, you don't have any hormonal imbalances. If all these things are evaluated, even after the evaluation, if these PCOS symptoms are hormonal or endometriosis or pelvic floor inflammation or vaginal infections, UTIs, everything is ruled out, but still you are experiencing these symptoms, then it is diagnosed as irritable bowel syndrome. In similar ways, these symptoms can overlap with inflammatory bowel disorder also. So when you have ulcerative colitis or inflammation in your colon region, or you have Crohn's disease, these kind of things initially when they are at a lower stage, I mean like initial at a manifestation stage, the symptoms may look like an IBS only. So there is a large scope that people can misdiagnose IBD as IBS. So this is the reason why other organic diseases of pancreatic insufficiency or fatty livers or hormonal imbalances, endometriosis, IBD, all these other organic diseases has to be evaluated, and if you are left with no answer, then you are diagnosed as irritable bowel syndrome.
So when every other parameter fails, then you
Yes, obviously, Casey, this is why it can get draining to figure out what exactly is happening in your body. So sometimes it could be a little bit of misunderstanding, like your symptoms looks like IBS, hence you are without any further evaluation, like without understanding pancreatic insufficiency, which is commonly one of those reasons for diarrhea, exocrine pancreatic insufficiency, or you had your bout of food infections. SIBO is commonly not well understood in the conventional medicine. They never talk about small intestinal bacterial overgrowth. So there are certain things which they overlook and only start treating you with an antibiotic, which can further worsen your condition. Situation.
It can be a liver disorder also.
A liver disorder, say in the liver disorder, what I find problematic is when you have gallbladder stones. So it can lead to a lot of bloating, and by the time the gallbladder stones are being diagnosed, it would be late for you, and before that you are labeled as irritable bowel syndrome. But now there are certain things which, if you are going to a doctor repetitively, say like first time you met your doctor, he might evaluate your symptoms and write it like an irritable bowel syndrome. But if you are seeing repetitively your doctor, the medication is not working, then you will ask to get an abdominal scan. Then you would be asked to get a test called fecal calprotectin, which would help us to understand if there is any inflammation in the intestines or infection in the intestines, and to differentiate between IBS and IBD. If it is a woman who is complaining of repetitive IBS symptoms, then the gastroenterologist would advise her to go and see a gynecologist and rule out the endometriosis and other possibilities, especially if the flare-up is high around your menstrual cycle. So this wise, for functional disorder like IBS, there is no one specific test which can pinpointly say like you have an IBS because of XYZ reason. It's always the evaluation done if your doctor has like enough time, or practitioners like us, we have to evaluate the case and find out the root cause. Where is this triggering from? Sometimes it could be as simple as mental health disorder, like you're not sleeping and overstressing and overthinking. Sometimes it could be as complicated as because of your gut issues, you've been starting to think, you've been overthinking and you're disturbed. So yeah, there are many things to understand. It may look like a simple functional disorder, but it can impact your social life, personal life, and financial life very badly.
Makes a lot of sense. But then one other question I feel is, if it is called irritable bowel syndrome, is there any way that you get a colonoscopy done and then you can identify something out of it?
This is what I'm saying. When we are trying to understand IBS, colonoscopy is done at a condition just to rule out that there is no IBD. Or are we misinterpreting IBD as an IBS? So colonoscopy will not tell you have an IBS or you don't have an IBS. No. Colonoscopy can tell us if you have any, what are we missing? Why is your diarrhea not resolving? So when you go to a doctor with a, this is the first time you are meeting your doctor with diarrhea, he looks for certain red flags. What are the red flags? Blood in the stools, rapid weight loss, and loss of appetite, or you have lot of mucus. If these criteria are met, then your doctor will ask you to get a colonoscopy done. In the colonoscopy, it can come abnormal, it may not come abnormal, or there are certain things like polyps in the colons, inflammation in the colon, infections in the colon. These things can be evaluated using colonoscopy, but again, it's not a direct diagnostic tool for IBS. Just because your colon is healthy and you are symptomatic, then it comes under IBS. If your colon is not healthy, you are being treated for IBS, but your doctor did not notice, or it's been not diagnosed or not evaluated for IBD. As a second stage of evaluation, you would be asked to get a colonoscopy done, because the process could be little awkward, so, or it's not really necessary. When you have a diarrhea, you would be asked to take certain medications for a while. 15 days of antibiotics or some other course will be given. If the client is showing up any red flags or symptoms of IBD, then your doctor would advise you to get a colonoscopy done. Yeah.
Okay. So, as it is a complicated disorder, even to understand it, you need to rule out a lot of options to finally come to a conclusion. Now, what are the treatments that you offer, Vineesha, you being an IBS specialist?
Okay. See, these IBS is very complicated. It might look only 4 symptoms, but it is enough to, make you sick. This is not life threatening. This is not going to kill you, but it would disturb your day very badly. So each case is very different, Casey. I can give you 4 examples. So there is one case where he has extreme anxiety issues because of the trauma which he is going through. So that is making his have hyper gut motility. Whatever he eat, because of too much of stress, it is making him to poop. In that case, what we do is, when we are counseling a client or taking in a client, we try to understand where is this coming from. Where are these gut issues coming from? We try to evaluate the stomach acid, infections, inflammations, and then gallbladder health, liver health. We see, like, is it a dysbiosis? The client has used like a lot of antibiotics before. He been on antacids. What is his weight? Every evaluation is done, and if we feel the client has one major issue of trauma, or he's been highly stressed or living in a stressful atmosphere, we ask them to take talk therapies along with the dietary modifications. If it is a diarrhea case, we use counter probiotics like Esboladi. There are many other supplements which can help you to slow down the gut motility, and here the root cause could be small intestinal bacterial overgrowth, something like that. So each case is very different, Casey, based on an individual root cause analysis. How did you end up with IBS? Did you take the same questions are repetitively asked to understand the root cause, and we compare this root cause with the blood work also, Casey. If I feel the client symptoms are really abnormal, I will make sure that I'm evaluating IBD also. We ask a client to get fecal cal, or if the symptoms are like he's passing 8 bowels in a day or 9 bowels in a day, we redirect it to the doctor and make sure that they're getting necessary tests. We actually ask them to get certain tests. They can go and show the same prescription to their doctor, or they can directly go see a doctor and communicate the same. So each case is very, very different, right from the thyroid imbalances to the body weight to the infections. I believe IBS in 80% of the cases is an infection case. There is a bad bacterial overgrowth. It can be your own gut microbiome which is making you sick. We have a balance of good bacteria and bad bacteria. So whenever your gut is not working properly, you would be high on candida or fungal overgrowths. So that your own gut microbiome can make you sick, or you ate something from outside and you got an infection. From there, your gut issues have started. So it's either an external infection, or your own gut microbiome is making you feel infected. So we correct all these things based on personalized approach and make sure that the client is progressing well. So it's a 40 minutes of evaluation which we do, 30 to 40 minutes. We have a long questionnaire to be asked. We send the questionnaire to the client also. Based on his answers, we derive a lot of understanding, like what to be treated for that particular case, Casey.
And how long will it take for you to reverse this
There are
condition?
cases where we have sorted out in 3 months. There are cases where they come based on how quick you come to us. Okay. There are cases where they've been suffering with for the past 15 years. They have diarrhea. Imagine what would have happened. So you have like 5-6 bowel movements every single day. You are weighing around 30-35 kgs. I have clients who are underweight and prolonged diarrhea cases. Those things will take definitely a long time. In those cases, I can't promise ki I'm going to reverse everything about yourself, but we would try to put our best foot forward and see what best we can do, because this is a very long standing infection. It's not like just because I'm certified, I'm not going to magically
To
heal
do
you.
some miracle.
Yeah.
So the minimum time you would need for a basic
3
is
to
3
6 months is for IBS definitely.
Definitely.
And IBD cases may take a little more time. Yeah, it's more
But are they
complicated.
reversible? IBD and IBS are reversible?
It's IBD may there are in IBD there are many things to understand,
We
Casey.
will do a separate
Yeah,
podcast
we'll
on
do.
IBD.
Yes,
Ah.
it's better. IBS, it's remission, which means that if you have lot of symptoms, you eat anything, you are bloated, you have quit. There are people who quit their jobs because because of this irritable bowel syndrome also. So when you say reversible, as long as you take care of certain dietary habits and certain lifestyle habits, you can happily lead your life. Okay, so there is a myth. I completely call this as a myth that once you get an IBS, your life is never sorted. But I feel with our experience, at least we have spoken to 2000 or 3000 IBS clients. So they are all warriors. They have a lot of things, and a lot of people came out very easily from this irritable bowel syndrome. 80% has come out easily. 20% are still there who are on the midline. It's not like nothing has resolved, but still they have to deal with certain things. So as long as you understand your gut, as long as you understand your tolerances, you take care of your mental health and lifestyle, you're not going to see your IBS back. Again, you get back into your old habits of alcohol, smoke, and you eat whatever you feel like eating. You don't sleep in time. This doesn't cure your
That's
disease.
all what you said is it is, if you don't follow it properly, you'll always get it back.
Yes, sure. But it wouldn't be worse. See, the difference between IBS is complicated, dietary modifications are complicated. But once you understand your personalized approach to treat it, and in IBS case, it's just not the food modifications, but you need a certain supplements. Say like you don't have the digestion capacity, so we suggest some kind of digestive enzymes or beta HCLs, something to strengthen your gut lining, some vitamin and minerals that can help you to produce enough stomach acid. So there are certain probiotics which we do, which act as a antibiotic actually to your gut. So it's a combination of supplementation and dietary modifications would only work for irritable bowel syndrome. There are no cases where they gave up on certain, only the diet has made its miracle. But if your diet is really messed up, then we correct it along with the supplementation.
So, for the benefit of my audience, Vineesha, so what are those dietary modifications, for an example, a person would be recommended for an IBS?
Okay, there is something called as, I want audience to understand, in 80% of irritable bowel syndrome cases, the root cause is small intestinal bacterial overgrowth or low stomach acid. These two, and gut microbiome imbalances. These three are the things. So you can differentiate easily whether you have SIBO or not by using certain dietary modifications. So if the fiber is making you bloated, so now that your major symptom is constipation, for any constipated individual, what we can suggest is like increase your fiber intake, increase your water intake. This is what the common suggestion goes for constipation cases. But there are people who can't even touch 10-15 grams of fiber. The moment they eat a carbohydrate rich food like idli, dosa, poha, or they eat a lot of fiber, any curries, 2-3 vegetables you add in a single meal, they are bloated like crazy. So this is called as eating fermentable FODMAPs. These are called as high FODMAPs. FODMAPs are the foods which are highly fermentable by the bacteria in your small intestine. So anyone who is suffering with irritable bowel syndrome, I want all of them to open Google and learn about FODMAPs. What are the list of the foods that can make your small intestinal bacterial overgrowth go crazy about it? They are fed by these FODMAPs. So the first step is to be on a low FODMAP at least for 2 to 3 weeks to understand whether you are suffering with a SIBO or not. That's one simple advice. Second is, in my practice, 99% of the clients with irritable bowel syndrome are intolerant to gluten. Anything you made with wheat, maida, or wheat byproducts, you see like you're bloated and your constipation or diarrhea get worsen. Third one, so try to be on gluten-free diet. Third one is dairy. If you are drinking coffee, tea with milk or too much of dairy products, like if you eat 1 tablespoon of curd, that goes well, but beyond that it can trigger their gut very badly. So common intolerances goes towards gluten and dairy. So I would advise 21 days of low FODMAP along with gluten and dairy free diet. That would be really beneficial. If this small 21 days of dietary changes, in this 21 days just stick to the homemade meal. Kindly do not keep on triggering your gut. So the common mistake which people do, and I find it so surprising, is they rest their gut for 4 to 5 days. The symptoms are good in that 4 to 5 days. Whenever they stick to the homemade meal, the symptoms are pretty good. But again they start going outside and they eat, they drink, they smoke, and again the alcohol, they trigger their gut again. They end up with a bad bout of diarrhea. So they rest again for 2 to 3 days and they start their eating habits again, lifestyle. So if you keep on triggering your gut, people who have repetitive infections, kindly note that after a point you wouldn't respond to any sort of antibiotics and any sort of treatment protocols. So do not repetitively trigger your gut and end up with diarrhea. I have such one case. We did beautifully for 2 months. 2 end of months, he been eating outside every single day before meeting us. Every single day. He has diarrhea, but still he eat every single day. I was so surprised with this behavior, Casey. Your gut is not good and you are eating, still continue to eat every single day. So he came to us. We worked very hard for 2.5 months. It's a lot of work from our side also, Casey. Multiple counseling sessions, and we have to reassure them.
I understand the pain.
Yeah, you don't need to take an antibiotic. You have been overdoing on antibiotic. Let's wait. Let's, jump on to this supplement. Let's make this dietary modification. So it's every single day we have to call him and make sure that he's sticking to the thing. Again, in the 3rd month, he went and he's not been on, whenever you are eating outside, at least choose your food wisely. But he went and he ate pav bhaji, pani puri, everything. He ended up with diarrhea. From there, no matter what we do, what medication we do, he has very bad acne flare up all over his body. His diarrhea is not stopping. His mucus is not stopping. What is there in my hands at that point to do? I am not a doctor. I can't do an emergency treatment. I am someone who can help you. Once you work with your doctor, you try every single thing out there. If you haven't found your solution, then come to me. I'm not saying like you come to me before meeting your doctor. Meet your doctor.
Only then probably they understand the value of what you do.
Get the prescription. First see the doctor, because the diagnosis should always come from the doctor. See the doctor. From there, what is the functional aspect of your IBS? I'll be taking care. Is it a candida, bacterial or microbiome imbalance, low stomach acid, digestive imbalances? That thing though I'll take care. Yeah.
Makes a lot of sense, Vineesha. So thank you so much for explaining us.
My pleasure, Casey.
What is
IBS.
So thank you so much, Vineesha.
Thank you.
Yeah.